In this video, we're going to talk about conditions that affect the placenta and what can happen to the baby because of them. Two high-yield concepts to know are uterine rupture and abruptio placentae. With uterine rupture, the mom is going to have severe abdominal pain, vaginal bleeding, but the key buzzwords are loss of fetal station. So if the baby is at 2+ station, let's say, and they retract to 0, that's loss of fetal station. And also, since the uterus has ruptured, you're going to have palpable fetal parts, or they can describe an irregular abdominal mass. So for this, you have to go for an emergent laparotomy. And some risk factors for this are prior C-section, because your uterus is already weak and it can easily rupture, or if you're having a large baby, or if you have a short inter-pregnancy interval, so like less than 18 months between the two babies. Abruptio Placentae, the risk factors are hypertension, using cocaine, smoking, because both of those things will cause vasoconstriction, or abdominal trauma is another big risk factor as well. This will present with sudden onset of vaginal bleeding. So again, like that makes it a little bit hard to differentiate, but as long as you know the risk factors and how they present, it should be pretty easy to tell them apart. Abruptio Placentae will present with a tender, firm, rigid uterus and also have late D cells, which makes sense because if the placenta is ruptured, late D cells indicate uteroplacental insufficiency, so the baby's not getting good oxygen. So then some complications of this can be fetal hypoxia and preterm birth. Placenta Previa is when you have painless vaginal bleeding after week 20, and you'll have a reassuring fetal heart tracing. As opposed to Vasa Previa, this is more dangerous. You're also going to have vaginal bleeding, but the fetal heart tracing is going to decompensate quickly, and the risk of fetal demise is quite high, so you want to do an emergency C-section. For Placenta Previa, some risk factors are having a previous previa, having a previous C-section, or multiple gestation. You always want to do a transabdominal ultrasound first, just in case there's a previa, so you can diagnose it. So if there is one, then you definitely don't want to do a digital rectal exam. You don't want to do a transvaginal ultrasound. You tell the patient to refrain from sexual activity. Placenta accreta is when the placenta attaches to the myometrium. Increta is when the placenta goes through the myometrium, and placenta percreta is when it goes through the myometrium all the way and attaches to the serosa. So I just remember AIP. A is the closest, P is the furthest, deepest in. And after birth, the most common cause of postpartum hemorrhage is uterine atony, but another cause can be retained placenta, which can occur due to either accreta, increta, or percreta, and this will present as an echogenic mass or a thickened endometrial strip on ultrasound. You'll have to do a DNC to get these pieces of the placenta out, and patients will present with continued bleeding after birth, but their uterus won't be boggy like it is for uterine atony. Their uterus will be firm and contracted again. So if you have a monochorionic, monoamniotic set of twins, that means they're sharing one sac and one placenta. This causes a risk factor for cord entanglement. Now let's say you have monochorionic and diamniotic twins, meaning they are in their own sacs, but again, they're sharing a placenta. This will show, like on ultrasound, a single placenta with a thin inter-twin membrane between the two sacs, and where the placenta will meet will form a T sign. And just remember T for twin-twin transfusion. So the placenta can make human placental lactogen, and this usually occurs in the 3rd trimester, and this causes an increase in insulin resistance, which will cause gestational diabetes. So when mom goes in for her regular prenatal checkup, they do an umbilical artery Doppler sonography, and during that, if they see absent or reversed umbilical artery and diastolic flow, that's bad. That indicates fetal hypoxia, and they should deliver right away.